Good evening, ladies and gentlemen, and welcome to Teagasc Moore Park. I'm Stuart Childs, Teagasc Dairy Specialist, and I'm your host for this evening's webinar. We have an exciting panel lined up for you to discuss vaccination of the pregnant cow and common diseases and treating scour of calves. So come join me inside to meet the panel. Good evening, ladies and gentlemen, and welcome to tonight's webinar. Tonight we're going to focus on the topics of vaccination of the pregnant cow, common diseases of young calves, and how to deal with scour, which is obviously something that many of you are going to be facing into potentially during the course of the next couple of months. So I have an expert panel with me tonight, and I'll ask them to introduce themselves. So I'll come to you, Catherine, first.
Thanks a million, Stuart, and thanks for having me. My name is Catherine McAloon. I'm a vet and I work in the UCD Herd Health Group in the School of Veterinary Medicine in UCD. I'm also the current chair of the Animal Health Ireland Technical Working Group.
Thanks. So Michelle, you're next. You were on Monday night in where I'm sitting at the moment, but you're being under scrutiny tonight.
Yes, thanks, Stuart. My name is Michelle McGrath. I'm a vet also, and I work with Animal Health Ireland for the past year. I'm also a member of the CalfCare Technical Working Group, and prior to that I was in mixed practice for about 10 years.
And finally we've Ciara Hayes. So Ciara, tell us about yourself.
Thanks, Stuart. So my name's Ciara Hayes. I'm a research officer at Cork Regional Vet Lab. We provide clinical and pathological services to farmers, and I'm also a member of the CalfCare Technical Working Group.
Okay, excellent. So thanks very much. So you can see that we have plenty of expertise on hand tonight to answer your questions. So we're just going to move to a short video, which is in relation to the situation around vaccination of cows in advance of calving. So we'll just move to that for a brief period, and we'll come back to questions here in the studio then in relation to that. Just before we do go to the video, I'd encourage you to engage with us through the Q&A function on the bottom of the screen. And we'd like to get as many questions as you can into us, and we'll try and deal with as many as we can throughout the course of the hour ahead. Thanks.
Calves are born without any protective immunity. They only receive protection once they absorb antibodies from colostrum, which is the first milk the cow produces after calving. This protection covers the calf until they can develop their own immunity, which begins at 3 to 4 weeks of age. Antibodies in colostrum are large proteins that are absorbed by the calf. The ability of the calf to absorb these antibodies decreases every hour from birth and stops by the time the calf is 24 hours old. This is the reason why ensuring adequate colostrum intake as quickly as possible after birth is so critical. It is recommended that 3 litres are given within 2 hours of birth from the cow's first milking. The quality of colostrum can be improved by providing strategic vaccination to the dam and ensuring she has adequate nutrition throughout the dry period. The role of proper nutrition in supporting immune function cannot be overemphasized, and one directly influences the other. The main goal of vaccinating cows pre-calving is to maximize protection against calf scours caused by rotavirus, coronavirus, and E. coli. For this type of vaccination to be effective in transmitting protection to the newborn calf, it must be delivered at the correct dose and be given at the correct time. It takes about 2 weeks for a cow to respond to this vaccination, so it needs to be given 3 to 12 weeks before calving. A separate vaccine is available to protect calves against scour caused by salmonella. The timing of this vaccination is a bit more complex, depending on if you want to reduce scours caused by salmonella or abortions caused by salmonella. Farmers should work with their vet to create a suitable vaccination program specific to their farm. Pre-calving vaccinations stimulate production of antibodies in the cow, which are then directed towards the mammary gland when she begins producing colostrum. providing a first line of immunity to the newborn calf within hours of birth. It should be noted, however, that scour prevention isn't as simple as using a vaccination, and vaccines should not be seen as a silver bullet, but as an important tool in disease control. Preventing calf scour is a combination of many factors, including provision of a warm, clean, well-ventilated environment and ingestion of good quality colostrum from well-nourished, healthy, vaccinated cows.
Okay, so Michelle, you mentioned there in the video that vaccination is only an aid to prevention of scour. Is it necessary for all farmers to be vaccinating for scour?
Well, it's a good question, Stuart. I guess if you've had problems in your herd previously with scour, it's definitely something worth doing. But for herds that have never had a problem with scour, it is expensive, so it wouldn't be the first thing I would be doing. So, but certainly for herds that have had scour, I would recommend it.
Okay, so and in terms of when to, we'll say, the options around the vaccination, I suppose Joe would have said on Monday night about the latter half of the calving season being the problematic time for calves with scour and so forth. So that second group of calves going through the house are the ones that are exposed to the greater infection pressure. Is it justified to vaccinate all cows? Should you vaccinate every second cow? You often hear that at farm level, that people vaccinate every second cow, or maybe should it only be the later calvers?
Well, I suppose ideally do every cow if you have a problem. But if it is an expensive enough vaccine, so if you're worried about it, and it is generally the later part of the season, because as you say, the infection pressure has built up, then so a lot of farms would only do the second half or the last third of the herd. But I wouldn't really agree with every second cow, because they mightn't calf that way, and it's kind of more tricky. And plus, from a colostrum point of view, it's better to give the calf should get her own mother's milk, so that wouldn't work either. So
okay, so and I suppose Catherine, I'll just come to you then, and there's a question in from the audience as well. I'll come to that in a second. If in the seasonal calving systems that we're operating in Ireland, and clients at Teagasc now are really and all dairy farmers in the country are beginning to really push up. We're moving up towards 70% calving in 6 weeks now as a national figure. And on some herds, maybe 85 and 90% consistently calving in 6 weeks. Is it when is the most appropriate time to vaccinate those in terms of scour prevention?
The scour prevention vaccines, I guess, Stuart, they have to be in time to allow the cow a chance to make the antibodies and then concentrate them in her colostrum. So they reckon at least 3 weeks before calving, but you can also give them between 3 and 12 weeks before calving. So, anywhere within that range.
And I suppose maybe slightly a slight twist in the topic. Obviously today is the 20th of January, and if cows are generally probably calving from the 25th of January onwards around here, it's late now obviously if for that 3 week window that you're talking about. Is it still worthwhile doing it at this stage?
I guess it depends on the farm. Probably not for those early calvers, as you won't get the kind of return on investment and ensure that they've had a chance to make the antibodies if you're spending the money on it. But at this stage, you still could consider doing your your March calvers and so on, and the latter half of the season.
Okay, so and the question that's come in from the audience there now is in relation to vaccinating on the same day for different items. Like IBR would be a vaccine that would be associated with late December, early January, and the question is, can both IBR and Rotavirus Corona be given on the same day? And I suppose to add on to that, then the idea of maybe vaccinating for lepto. It has kind of tended to be pushing back a small little bit in terms of maybe coming back from the traditional Valentine's Day, Patrick's Day kind of for the booster scenario, just from a workload point of view. Have you any comment to make on those? And I suppose in particular on the fact on whether you can or can't do IBR and Rotavirus together?
It's a brilliant question. I guess it sort of depends is the answer. The use and cost that we spend on vaccines is a significant investment for the farm. So we kind of want to make sure that they do their job. And there's sort of two things within that. One, we want to make sure that the vaccine is efficacious and does what it's supposed to do, but also that there's no adverse reactions. And unfortunately, there's not a lot of data on, different combinations of vaccines, and the data sheets will tell you that it's really on a case-by-case scenario, depending on the combos you want to use and so on. So it really depends, I suppose. I guess, certainly I would have come across lots of farms that would be vaccinating for 2 things at the one time. I certainly wouldn't go beyond 2, because we are asking the cow's immune system to respond and to do work. There are things like salmonella vaccine should not be given with anything else. It really is a sort of case-by-case scenario what you want to do. So for example, people may, and I have, lots of times come across, people will do like IBR and BVD together in early December, and then they may do scar vaccine, a few weeks later. I just would be careful what I'm asking the cow's immune system to do at once. So the data sheet won't stand over combinations of vaccines. Of course, there's a few exceptions there. So we just really have to take that on a case-by-case scenario, and probably the best person to ask, depending on what combination you want to use, would be your vet, because they'll know what type of vaccine you're using and so on.
Okay, so I suppose just in relation to, obviously we can go to the bother of vaccinating cows for scour prevention, but is there a critical step that has to be followed through on if we do vaccinate these cows in order to get the protection? I'll put that to you again, Catherine, maybe.
I guess if we're going to invest in scar vaccines, then we certainly want to make sure that the colostrum management is excellent and as good as it possibly can be to make sure that we get the good out of it. But it goes without saying, with or without scar vaccines, the colostrum piece is so important in calf health anyway. But I guess it certainly focuses the mind, if we've spent that money on vaccinating the cow, on ensuring that the calf gets the good out of it.
And I suppose a very common question that I would hear on the ground always is in terms of how long should they actually get the colostrum or the transition milk from the treated cows in order to try to maximise protection in terms of scour?
I guess that's another brilliant question in terms of, and it really depends on the farm. I have to say, depending on the scar vaccine that you use, some will say there's a benefit for giving the colostrum or transition milk for longer. Some will, there's kind of an undefined amount of time. So it is kind of dependent on the goals of the farm. So for example, farms with Iones issues or potentially Mycoplasma bovis issues may want to just feed their 2 or 3 feeds of colostrum, possibly, a few feeds of transition milk, and then move straight away, or perhaps they'll move straight from colostrum 2 or 3 feeds onto a milk replacer. So it sort of, and that can be done safely, and it really depends. I suppose the kind of middle of the road advice, unless there's a specific bespoke approach to a certain disease, will be your 2 or 3 feeds of colostrum and, maybe 3 to 4 feeds of transition milk, and then move on. But that is, again, depending on your goals and certain disease specific to the farm.
Okay, so Ciara, coming to you, I suppose from your experience within the veterinary lab, Michelle mentioned in the video about salmonella scours. Would it be something that's quite common? It wouldn't have been something that I would have heard a lot of about, really. I know where salmonella does affect calves at this stage of the year. It can be very severe, the consequences. But is it in terms of vaccinating for it? What's your experience in the vet lab, and what's your recommendations around the vaccination protocols?
Yeah, so certainly what we find from submissions that we get into the lab, we are far more likely to grow salmonella from a fetus than we are from a sample of calf scour. So definitely my recommendation would be that you are giving salmonella vaccines to target an abortion problem, unless, so the only time I would deviate from that is if you have in the past had a problem with calf scour that was diagnosed as salmonella. So other than that, I would be timing the vaccine to cover the risk period for salmonella abortion, because it does appear to be much more common presentation as abortion rather than as scour.
Okay, so we have some questions coming in from the audience there. So Michelle, I'll put this one to you because it's relating to some of what you would have been discussing on Monday night. Is using hydrated lime a good aid to reduce infection in between batches of calves when cleaning out?
Yeah, the general consensus from the panel on Monday night was that it's very beneficial, because there was some concern about it being negative effect on the calf, but that wasn't said the other night, and it is very beneficial because one of the main things about cleaning out when the calves are in the shed is trying to keep the moisture down, and it's not recommended to power wash like mid-season or that, because you're aerosolizing all the bugs. So one way to kind of improve the hygiene between calves is the use of lime.
Okay. And Catherine, plenty of questions coming in relation to the different vaccines and the combinations, which you'll be delighted to know. So I'll give you the easy one first, I suppose. Can BVD and lepto vaccines be given together?
I guess it depends. Certainly, I do my own cows with BVD and lepto at the same time and have done that, and that's fine. But again, you have to be careful, because if there ever becomes a problem, then the vaccine company won't necessarily stand over it. So in terms of the licensing, there is only kind of a few exceptions, such as like BVD and IBR, for example, is one that is licensed together in a certain product. And again, it depends on who makes the vaccine. So BVD and lepto is a very commonly used combination with little adverse effects that are reported. That's not a guarantee that they won't happen, but yes, that's something that would be widely accepted as done.
Okay, so would it be fair to say that if the company is if they're crossing over companies, the chances are that they haven't been tested to be operated together? But if you're dealing with the same company for both vaccines and it has been tested, then it's probably safe enough to go ahead.
I guess it's something that, again, I think it's a bit like kind of vaccine calendars and so on. There's something that you really should kind of chat to your vet about, because the day you make one, it's out of date, because they're so dynamic and can change year on year and so on. And that's why I think it's really important to have your vet involved in your plan and your herd health plan for those kind of things. And the reality, I suppose, is that the research isn't done, and it's not impossible that you don't have an adverse reaction. Lots of them are commonly used together. It will say on the insert in the box, for example, BVD and IBR are licensed together with one product. So you sort of have to consult the data sheet for each product, because they can be slightly different.
Okay, so, and this is a good one. Is it possible to vaccinate the calf against scour? And if not, why not?
Well, if I could come up with a vaccine for crypto, I'd say that might be my career-making move there. I suppose currently there's a couple of reasons for that. One, I suppose there's not robust enough research or kind of enough science, proving that products, and there certainly have been lots of different products trialed and so on, but we just haven't quite got there yet. There's a couple of things around the calf's immune system, and it's really only developing in early life, and part of the reason that they're so susceptible to things like scar and so on is that the immune system locally in the gut is very underdeveloped in early life. And also you have the interference with the potential of antibodies that they have from their mother's colostrum, and that can interfere with a vaccine response to particular scar pathogens and so on. So I suppose if we think about how a lot of the vaccines work, particularly the scar vaccines, they're inactivated. The cow one, rotavirus, coronavirus, those kind of the ones to the viral diseases at least, they're something that would require the calf time to respond to, like we do most 2-course vaccines and things. So there wouldn't necessarily be time, there wouldn't necessarily be a competently developed immune system to respond. And I suppose we just haven't the science to find products that are proven to work in the young calf just yet.
Okay, very good. So Michelle, I suppose there's just another one in here. And is 12 weeks too far out to vaccinate the cow? Should we be splitting that? So I would know that Ricky over in the Kilworth farm here would actually do the blocks of the February calvers have been done. The March calvers are probably on the points have been done. Your thoughts on that? And I have another one then as well, actually. Would it provide better immunity basically by breaking it up into 2 6-week blocks maybe?
Well, again, we'll go back to the data sheet. It's licensed from 3 to 12 weeks. So I guess it depends then. If the cow goes over time, then you are pushing it out a bit. So it might be better from a practical point of view, and in case they didn't calf when they were supposed to split it up.
Okay. And in terms of salmonella vaccines then, Ciara, the question is that it's coming back to what Catherine has maybe already said, lepto delivered on the same day with salmonella. Is that a problem basically from the point of view of having done that? And the other question is, when's the best time to actually vaccinate for salmonella then?
So if vaccines are not licensed to be given together, which certainly as far as I'm aware, there are no salmonella and lepto vaccines that are licensed to be given together, then no, I wouldn't be doing those on the same day. And then in terms of the time to vaccinate for salmonella, if you're wanting to target Salmonella abortions, then you need to be going back to the data sheet for the specific vaccine and looking at when they recommend and how far out, because obviously the vaccine needs to go in advance of the risk period. So it may be specific to a certain vaccine. So you need to be looking at your data sheet and sticking quite rigidly to that to make sure that you are covering them at the risk period.
Okay, thanks. So I suppose just to wrap up on the vaccination piece, and we're going to move on to the common diseases of the calves, and we'll come to some of the questions that are coming in relation to that. Is it fair to summarise it in basically that, like you said there, Catherine, that vaccination calendar is a very important piece of kit for every farmer, and that they really need to plan out their vaccines, deliver them at the appropriate times, obviously, to get the full impact and get the bang for their buck, literally, in every sense. But also to give the cow, like, is there a risk that you could actually compromise an animal by overloading them too quickly? Like, I suppose I'll put it to you first, Catherine, and I'll ask Michelle and Ciara for their thoughts as well.
Yes, there is. And, for example, like Salmonella vaccine, I suppose most commonly in Ireland is given the sort of August, September time. And that's probably something it's given, on its own. I think it is recommended that it is given on its own and certainly not given with other products. And you see the issue, of course, is that if we spend the money on it and we don't do it we may not get the result out of it, but we also run the risk of adverse reactions. So I certainly would definitely not do more than two separate vaccines at the one time. So like that's not the same for multivalent vaccines, things that have multiple things in the one shot, but two separate shots, I definitely wouldn't be doing more than two at a time. And I would be consulting with my vet, what combination I want to do, and I'd be building that into my vaccine calendar and so on.
Okay, and Michelle, I suppose I'll throw a third element into it as well. So like at this time of year, obviously people are maybe just after Christmas, there's a bit of dosing done and so forth. And the temptation is, because we're putting cows through the crush, let's try and give them as much as we can so that we don't have to put them through again because of the fear of causing cows to calve early, etc. Is that a risk factor? So the dosing, we'll say lice obviously probably, I'd assume, wouldn't be a problem, but maybe liver fluke and worm dosing.
Yeah, I guess it is more of a risk, especially for the liver ones, because like the liver will be involved in a lot of kind of immune responses or just in general breakdown of products. So I probably wouldn't, plus the withdrawal near calving probably would be too soon anyway as well. But I would echo what Catherine says. Well, I was always told to give Salmonella on its own. It seems to be the one vaccine that can cause problems if given with others. Okay,
Ciara, I suppose not to be going over the same ground, potentially I'll throw another element at you then. Is it better to give the vaccines into the neck or into the rump, or where is the most appropriate site for delivery?
So again, I'm going to go back to the data sheet. So certain ones are licensed for certain places. I do think that there can be sometimes a health and safety issue with giving them into the neck. You do need to make sure that the cow is kind of, well caught up, and you're not going to get your hand trapped or anything by kind of going in. So that's certainly something to definitely be aware of. But again, I would be sticking to what's on the data sheet, regarding where it's recommended to administer it, and just be careful as well. Some things may be licensed to be given into the muscle, some might be licensed under the skin, and just be sure that you're following that to make sure that you get, your maximum result.
Okay, excellent. So we'll just move on now. We're going to move on to the next video, which is another brief video in relation to common diseases of the calf, and we'll continue the discussion in relation to that then subsequently. So.
Calf health and heifer rearing is an important part of any production system, and having to treat sick calves is incredibly stressful. Calf scar and calf pneumonia are the leading causes of disease and death in young calves, particularly pre-weaned calves in Ireland. Therefore, control and prevention of these diseases provides a great opportunity to promote excellent calf health, but also to reduce antimicrobial usage. The regional veterinary laboratories have shown that the leading cause of calf death in under 1 month of age calves in Ireland is calf scar. In those calves, many were also found to have failure of passive transfer, meaning that they didn't receive or absorb enough colostrum. The control and prevention of calf scar and calf pneumonia are broadly similar, and they really start with two pillars. Pillar one is reducing the infection pressure, or really reducing the number of bugs that a calf meets in its environment. And two is maximising the calf's immune system so that it can respond to those challenges. In terms of reducing infection pressure, whether it's for a calf scar or calf pneumonia outbreak, that really revolves around excellent standards of calf hygiene. That starts in the calving pen, in the calf pens themselves, and also in dealing with things like calf equipment and calf feeding utensils. It's important that those are cleaned properly, milk residue is removed, and if we're using automatic feeders, that teats are cleaned and rotated frequently. In terms of bedding, that's very important for calving pens and also for calf pens, particularly for young calves, because young calves really rely on keeping warm and dry. And if young calves are lying on a wet or damp bed, then they can lose heat to the floor. And that means that they can become cold stressed, and cold stressed calves tend to become quite sick. Also important is cleaning and disinfection, particularly at the end of the season, and it is important that you use a disinfectant that is active against Cryptosporidium. In terms of also controlling infection pressure, it's important to look at the environment in which the calf lives. Ideally, calves would have 2 metres squared per pen. They also should have good environmental markers such as good ventilation, good drainage in the shed, things like that. Those are also very important in terms of addressing calf scar and calf pneumonia problems. Pillar 2 in the calf health control and prevention picture really is around maximising that immune system, which starts with colostrum quality, colostrum management in general. And it's not just about giving enough good quality colostrum quickly enough. It's also about testing colostrum quality, about ensuring that colostrum is collected hygienically and stored properly. All of those things ensure that the calf not only receives enough, but will absorb enough colostrum. The final thing really is around vaccination. In terms of calf scar, you should discuss with your vet a protocol for vaccinating the dam pre-calving, as that can really help with calf scar problems. And in terms of maximising calf immune systems towards calf pneumonia pathogens, then there are lots of calf pneumonia vaccine protocols available, which can be discussed with your vet.
Thanks for that, Catherine. That's a nice little clip there. I suppose just in relation to the cold stress that you mentioned there in the video, will you elaborate a little bit more on that, I suppose, in relation to the climate that we're calving cows into in Ireland, please?
Yeah, no worries, Stuart. I think the idea, I suppose, around cold stress really comes down to the kind of young calf, that calf under 3 weeks of age and up to the 3-week mark. I guess for a young calf, their lower critical temperature is around 15 degrees. So it means on every day of the year where it's not 15 degrees outside or in ambient temperatures, that they need to use energy to heat energy. They need to use feed energy to keep warm, which means it's diverted away from growth, it's diverted away from their immune system, and cold stressed calves are often immunosuppressed calves, and it can really feed into a calf health or calf disease picture. So I guess, most days of the year, it's not 15 degrees in spring for those young calves under 3 weeks of age. And really, it's about trying to do what we can to ensure that that they're kept warm, and that the attention to that really is in that young calf picture. Once they're kind of over 3 weeks, 3.5 weeks, they're able to cope with much colder temperatures. So things like ensuring that they're fed enough and that we're on a decent feed rate. And also that the environment is set up so that we can try and control what we can to keep them warm. So and I think it's important that it's not just about having lots of straw and keeping them cozy and so on. A calf that is cold but also lying on a damp bed will have a much worse effect than one that is lying on a dry bed. And the same with draft. A calf that is cold but in a draft, the effect will be worse as well. So the wind speed also has a role. So doing what we can, like was discussed in detail the other night, to try and promote the areas that we can within a calf house, to ensure good drainage and no draft and so on, keeping them well bedded and well fed is a lot of what we can do to address cold stress.
Okay, so I suppose again it was discussed on Monday night, but it'll be a fairly balmy day in February. That would be 15 degrees. The role of calf jackets is it a go-to point for calf housing, or is it make sure that you have all the other points covered first and then the calf jacket comes into play, or would you be building your system around the calf jacket scenario?
No, I don't think there's something that's necessary for every farm by any means. but they are something that can be reached for, and a quick fix solution, perhaps if you don't have maybe the optimal drainage, the right fall on the floor. We're not going to be cutting drains in the concrete at this day of the year, so perhaps it's something that can be used in those situations. I have never had a farmer complain about them. They usually tend to be very successful where they are used. And it is something that it's in the toolkit and the armory that we can go to. But I don't necessarily think that every farm needs them. There are other ways of like promoting the things in the calf shed itself.
Okay, so Ciara, I suppose in the video, Catherine mentioned that passive transfer of immunity from the colostrum through to the calves. In your experience in the vet lab, what kind of numbers do you see in terms of that have adequate transfer and that don't, of the abortions or the calves that go through the lab for you?
Yeah, so in terms of samples, so blood samples that were sent in for us, and we run the ZST test on those to look at levels of antibodies. It's a kind of a proxy for levels of antibodies that the calf has absorbed from the colostrum. So in 2019, 65% of the blood samples that we got in from calves were optimal. Now that sounds okay, but that actually means that there were still another 35% of samples that we got that were suboptimal, and a portion of those will have been outright failure of passive transfer as well. So it definitely is something that is out there and something that we need to constantly be on top of and thinking of all the time. Yeah.
Okay, so and that's coming from blood samples, even from live calves, or is it just purely from?
That's from, so that figure is from blood samples that were submitted.
Okay.
Yeah.
Okay, and so I suppose just to highlight to people that if they have a concern about it, that they can actually take blood samples from, it doesn't have to be a calf that has passed away, unfortunately, like that they can take samples from live calves to check their passive transfer.
Absolutely, yeah, and that's something I would definitely be recommending. Everyone can do that. So get your vet out, get them to sample 10 or 12 calves. The calves need to be between 24 hours and 7 days old. And get those sent into us or any of the regional vet labs, and we can assess the passive transfer status of those calves, and that will give you an idea of passive transfer status of the group as a whole.
Okay, very good. And I suppose just in terms of do you think it's a quantity issue or a quality issue that's probably driving that passive transfer problem? Like we've invested a lot of time now between ourselves and AHI in terms of trying to promote that 1, 2, 3 of colostrum. So we would be hoping that a lot of people are now dealing with providing the adequate amount of colostrum at the point of calving, more or less. From your experience, we'll say maybe talking to people that have run into problems, is that an issue? Is it the quality or the quantity that's the trouble like?
Yeah, I think it's still an element of both. I have been to some farms that have had problems that are still not quite getting the full 3 litres in within the 2 hours, So I do think it's an element of both. But certainly there's a whole area around quality as well. So if you are getting, if you're sure you're getting your 1, 2, 3 right, in close to 100% of calves, and maybe some blood samples that you're sending are still showing that there's a proportion of calves with failure of passive transfer, I would definitely be thinking about quality and colostrum quality in that case, yeah.
Okay, so a timely question after arriving here in front of me. If you are testing colostrum and it's showing that it's a poor value, so Muireann Keneally would have done a video on that for us yesterday that people can look up if they want to, but basically falling below the 22 on the Brix refractometer. If you increase the feeding rate, will that compensate for the poorer quality?
So feeding more of it can, in some cases, but it can be hard to know exactly how much more you need to feed. So if it's a situation where sort of that colostrum is kind of one of your only options, then that's certainly something you can try, is feeding slightly more to physically get more antibodies into the calf. Another thing you could consider, if you're not on something like a Ioni's control program where you're specifically trying to feed only the own dams colostrum, you could consider feeding some colostrum that you have stored that you know is high quality from another cow.
Okay. And I suppose, Michelle, like, should all farmers be testing, like Mern's video yesterday? It's relatively straightforward to do, but I suppose the practicality of it, in your opinion, should everybody be testing all milk that's coming through for the first time to make sure that it's of sufficient quality, like?
Yeah, I guess it is best practice, and it isn't difficult to do if you're prepared, which was kind of the topic of our talk on Monday night. So, like, all you need really is some pipettes, some paper towel, and the Brix refractometer, and it can be done like within seconds. But I suppose one thing to remember is, like, the quality of colostrum doesn't, like, it deteriorates if it's not stored properly, which was referred to earlier, or if it's not collected hygienically, which sometimes I think people forget. And you could often see a bucket of colostrum lying around the dairy, and just because it was high quality when it was taken the day before yesterday, it doesn't mean it's still high quality. And if there are a lot of bacteria in it, then the antibodies aren't absorbed as well by the calf, even if it's given at the right time. So.
Okay, so another question in relation to the colostrum is, like, in terms of pooling, is it not a good practice? Is it a practice that people shouldn't practice, I suppose?
Well, as Ciara was saying, if you're on specific disease programs, or if Ionis is a concern, or as Katrin mentioned about Mycoplasma bovis, then it's not a good idea. But if you're confident that you don't have either of those things, still we prefer to do dam to calf, to be honest. But obviously the odd cow won't have any milk or heifer, so then you'll have to get some off another one. But the other reason it's not recommended is because if there was high quality and low quality colostrum, it might dilute the good stuff, you know. So preferably keep it to one. But that's...
Yeah, so I suppose if you had it tested and you weren't concerned about Ionis or Mycoplasma bovis in your herd, it is feasible to say that if you're mixing good with good, it's okay. You could get away with it.
I suppose, yeah.
Yeah, but ideally,
not too much pooling.
Yeah,
probably.
ideally, it would be preferable if it was dam to calf basically all the time. Okay, so I suppose there was just one other one that I was looking at there a second ago. We'll come back to it in a minute. In terms of the quantity, so you've touched on it there, I suppose, Katrin. The collection is obviously having a significant role. So coming back to my question to Ciara a minute ago in relation to the sufficient quantities versus the quality, it could actually be the collection method, could be the breaking point within a farm, rather than, like Joe would have said on Monday night, that the colostrum quality in general, unless the nutrition of a herd is particularly poor, shouldn't be an issue, or unless very poor silage quality. So would you elaborate a little bit in a small bit more on what Michelle has already said there about that collection process? Like,
yeah, definitely. I think it's important as well, and I don't want to get shouted at here for people that don't necessarily have night calvers and so on, but ultimately, I guess the main thing affecting colostrum quality is how quickly it's collected, and that's been mentioned there, I think, previously. And you know, there is lots of Irish data backing that up, that the longer after the cow calves that the colostrum is harvested, the likely to be the lower quality, and that's because in those weeks before calving, she's concentrating everything into colostrum. But the second that she calves, she's transitioning to transition milk. And equally, a cow that might be running milk before calving is likely to have you know, poor quality colostrum and so on. So how quickly we can collect it, you know, if we don't have a problem with calf health, or you know, our colostrum management is likely very good. If there are issues where, you know, we're looking for better performance and around colostrum quality, the first thing we'd look at is how quickly it's collected, and really looking at ways to try, and the sooner it's collected, the better. The next thing then, as you mentioned, there will be how cleanly it's collected. So, you know, having whether it's, you know, buckets specifically for colostrum, or, you know, if it's a unit that's collecting it, that's specific for that job and maintained with the optimal standards of hygiene, because that's the calf that's the most naive on the farm. So how cleanly, you know, dirt going into the bucket and so on, all can affect the colostrum quality and ultimately the end result in passive transfer in the calf. So collecting it, how soon we collect it, how cleanly we collect it, and how we store it can all have a role in colostrum quality. And they're the kind of things that we would be chasing in farms that are showing up with failure of passive transfer. And, you can actually culture the colostrum and look at bacterial counts and so on in terms of a farm investigation if we were going down that road. And often it'll be the devil in the detail around the colostrum harvesting where we'll be looking to make changes.
Okay, so we'll just have to wrap up on this section in a second now, but Michelle, just coming back to you again in terms of that Brix refractometer. Again, the events that we've done in the past would have looked at the colostrometers maybe, so some people might be using them. Would you be recommending the refractometer over that, or any comments on that?
Yeah, the Brix is more reliable really. The colostrometer is, which you dip into the bucket, it works by specific gravity, which can be affected by the temperature of the milk. So, for example, it works best at room temperature. So if the milk was too cold or too hot, then it can under or overestimate the level of immunoglobulins or antibodies in the colostrum. So from a reliability point of view, the Brix is definitely better.
Okay, very good. And I suppose, Catherine, just a point in relation to the jackets again, maybe, or the heating up of calves. There's two questions here. Hot boxing calves, is it recommended, or is there any benefit to it? And a kind of a similar question that has come in is, should every newborn calf be put under a red lamp? And then the other question is in relation to how long should jackets actually go on to calves for?
Okay, I'll start at the last one because it's probably the easiest. Up to 3 weeks, really. Once a calf is over 3 weeks, they're well able to cope with temperatures down to about 0. So, that's if they're fed at a reasonable rate. So up to about 3 weeks is probably where the real benefit is in that really young calf. The hot boxing idea is, this is something that I've come across many times, and I think it seems to work really, really well. Again, in answer to the second question, I don't think every calf needs to go under a red lamp, but I guess it depends on, is the farm seeing issues and so on. Hot boxing is something that's quite useful. The calf is dried quickly, kept warm, and in that first sort of very critical 24-hour period, you're getting around, some of the risks there. So certainly I've seen it work very well. There's not any sort of scientific literature that I'm aware saying that, you should do it. I suppose from experience, I definitely think that it's a good idea.
Okay, very good. So I suppose, look, we have to wrap up in this section. There's still loads of questions flying in, and maybe we might get a chance to deal with some of them. I suppose one thing that we didn't mention is probably the temperature of that colostrum. If we're warming it back up, it should be warmed up in a temperature of between 40 and 50 degrees max, so as not to compromise the colostrum. Is that a fair point?
Yeah, the water you're heating it in, yeah. Okay. You don't want to use boiling water, can damage the antibodies. Okay,
very good. So we'll just move on now to a topic that everyone is going to have to deal with, I would imagine, as I said, during the spring of 2021, scouring calves. So we're just going to go to a brief video on how to deal with the treatment of that.
Careful treatment of the scouring calf is vital to ensure a rapid recovery. The principles of remove, rehydrate, and continue to feed milk are crucial in the treatment of calf scour. Remove. Scouring calves should be removed from the group and isolated to stop the spread of infection. Scouring calves should then be fed and treated after the healthy calves to avoid carrying the infection from the sick to the healthy animals. Rehydrate. Whatever the cause of scour, rehydration is the most important aspect of treatment. Scouring calves use huge volumes of fluid as well as salts, leading to dehydration, hypothermia, and ultimately death if untreated. This fluid and salt loss needs to be replaced. Calves should be fed 2 litres of a good quality oral rehydration solution twice daily during the scour. This must be in addition to and separate from the milk feed. If calves will not willingly drink the rehydration solution, it can be stomach tubed. Continue to feed milk. Feeding milk will not increase the severity or the duration of the scour. Withholding milk starves the calf's immune system of the nutrients it needs to continue fighting the infection. You should continue to offer the normal volume of milk while the calf is scouring. However, milk should not be stomach tubed. Antibiotics. Antibiotics should only be used in calves that look sick, so if they are dull and weak, or if they have a high temperature. Calves that are bright and alert in spite of having scour do not require antibiotic treatment.
Okay, so Ciara, in the video there you mentioned about the isolation of sick calves. The practicalities of that in a seasonal calving herd can be difficult. Can you comment in terms of anything that you've seen on farm that's working well for doing this?
Yeah, definitely. So obviously there's going to be a spectrum of measures that you can take, and the more you can do, the better. In an ideal world, a calf that's scouring would be moved out of the building that the healthy calves are in. And again, ideally, you would wear separate overalls, boots, and gloves when you go into that calf. But that's not always necessarily practical or doable on every farm. So at a minimum, I would say that that calf needs to be moved into a pen where it can't have physical contact with healthy calves, so with solid sides basically. There needs to be a foot dip outside that pen, and the disinfectant that you use in there needs to be appropriate to the pathogens that are on your farm. So for example, if you know you have crypto, then you need to use a disinfectant that's active against that. You need to use separate gloves when you're looking after that calf, so you need to change your gloves. And you need to treat and feed a sick calf after all the healthy ones to avoid bringing disease. So at a minimum, in a pen with solid walls, no physical contact with other healthy calves, foot dip, changing your gloves, and feeding that sick calf and treating that sick calf after the healthy calves.
Okay, and in terms of nutritional scour versus an infectious scour, would you treat it any differently in terms of how you go about getting electrolytes into them, or do you worry about it if you think it's a nutritional? Do you let it work its way through, or?
Yeah, so that's I think a really important thing to think about. So no, I would not treat a nutritional scour any differently to an infectious scour. And there's kind of two main reasons there. The first is that when a calf starts scouring, you don't necessarily know whether it is a nutritional or an infectious problem. And the second is that for whatever reason a calf is scouring, it will still be losing fluid and salts, and it needs to have those replaced, whether that scour is infectious or nutritional. So any calf that's scouring, no matter what the reason, needs their 2 litres of rehydration solution twice a day.
Okay, very good. So Michelle, I suppose in the video, Ciara would have mentioned to not stop feeding milk. It's probably something that some people struggle with from the point of view of the old advice would have been to withdraw the milk. And so any comment in terms of, obviously, if the scour persists, people consider that it's the milk is probably still causing the scour. So just, I suppose, to give people comfort, I suppose, that they're not doing the wrong thing by feeding the milk.
Yeah, so that was the old advice, but there's been a lot of work done on that since, and it's definitely recommended to keep feeding the milk, and it won't affect the level of how long the calf will stay scouring. Plus, also, the calf needs the nutrition, to get through the infection and to grow if possible. So definitely keep feeding the milk. Okay,
and if they eventually start to go off the milk?
Yeah, I suppose, I should have probably started that by saying you need to know what kind of disease or what infection or what's the cause of the scour. So, but obviously if they're not improving and they aren't like after a few days, if they're not responding and they're going off, they won't drink the milk, then it's better to, you can stomach tube the milk. Plus, it's probably time then to call the vet sooner rather than later, because they're, probably completely dehydrated, and they, oral electrolytes at that stage probably won't be enough. They'll need IV fluids, and it surprises people how, you know, if you get the vet on time, how quickly or how well they'll respond to those IV fluids. So it's definitely better to do that sooner rather than later.
Okay, so Catherine, I suppose the chicken and egg scenario, is it the environment causes the scour, or is the scour kind of as a result of the environment? Kind of, it's hard to figure it out, is it?
I think I suppose the thing about calves is that they have, you know, that idea that, and like every infectious disease, and we see it at the moment, obviously with the pandemic, that, you know, different, you know, immune systems respond differently. So the host immune system is always going to play a role, and that's your calf and your colostrum and so on. But the environment definitely has a role. And I suppose the reality is that a lot of the common calf scour pathogens are on a lot of farms, you know, rotavirus and so on, and E. coli and all of that. And, you know, there are different sources of infection to the calf. So the cow herself may be shedding some of those pathogens in her dung around calving. So the calving pen, the calf pen, other calves, you know, fomites like buckets and feeding equipment, ourselves, you know, all those things can be a role in transfer of infection. And the source of the infection, you know, can be the cow, it can be the farm environment, can be water, can be bedding, and so on. So I know once it becomes contaminated, then infection can ramp up quite quickly. So there's definitely a role of the animal's immune system, but there's obviously a huge role of the environment, and there are different sources for contaminating that environment.
Okay, so just one of the questions coming in here from Olive is in relation to the electrolytes. You're recommended to feed them with a high SID value. Is there a list of those available? Do you want to take that, Michelle? Or Catherine?
Yeah, I guess I'll just start and Catherine can take over. There are a few essential requirements that a good electrolyte should have. Glucose, salts are the main ones, but just to make sure that, but as Ciara said previously, they're not all the same. Electrolytes aren't all the same. So you need to discuss with your vet and make sure you're giving a good one, because I've often been to places where they thought they were giving a proper electrolyte and it wasn't. And by the time I got there, you know, things had deteriorated rapidly. So you probably have something to add to that, Catherine, I'd say.
Yeah, I guess the SID is one way of looking at it, the strong ion difference, and ideally those electrolytes are between 60 to 80 millimoles per litre. You can calculate it by looking at the back of the packet. It's the sodium plus the potassium minus the chloride in millimoles per litre if you want to calculate it. I guess, and you know, there are, I suppose that's why I think it is important to echo Michelle's point in terms of, you know, speak to your vet, get used to a reliable one that you know works. And, you know, again, to echo the point that, again, I would have come across that sometimes, you know, powdered antibiotics and stuff are maybe, you know, used in, and to make sure that we're using an actual electrolyte, that we're giving it separate to the milk feeding, and that it's given, you know, at a time on its own. So at 2 extra feeds during the day and that kind of thing is also very important.
Okay, very good. There's absolutely loads of questions flying in here. I don't think we're going to be able to get to them all. So I'll try and pick out what we kind of see has been important. I suppose a lot of these are relating back to not necessarily treating scour, but how to prevent it maybe in some cases. Crypto was mentioned, I think, earlier as well. But is there any advice in terms of prevention of it, treatment and recognition? So, and that there's a second question dovetailing off of that, I would say, is in terms of the rapid tests as well, Catherine, which I'll put to you. So, Michelle, you might take any advice in relation to the crypto, and Catherine, you might take the rapid tests idea then.
Yeah, crypto has probably become more of an issue as herd sizes have increased, and if hygiene isn't great, even hygiene mightn't be great in small places either. But and it only needs a small dose, you know, to be very infective. So, but like one animal can shed like enough to infect like thousands. So. in relation to preventing it, it's a very hardy parasite, and it needs like special disinfectants and like a period to dry out after. So again, like as we're running out of time, as you're saying, so it is something to discuss with your vet, or even the AHI website has good leaflet on how to diagnose it, how to treat it, and all. If you wanted to look it up. I think that's about it, really. Yeah.
Okay, Catherine, the rapid tests, have their role to play?
I think they're great, and lots of vets are using them, and you can get a rapid answer. I suppose they do have their limitations though, and I have, to echo that, and sometimes when I've been involved in outbreak scenarios where diagnosis has been delayed and so on. So the rapid tests are good. They don't necessarily tell you about all pathogens, so there are some that are not on that kit. If the answer doesn't make sense to what you're seeing in front of you, then you may need confirmatory tests. So taking a few samples and sending them to the regional lab, or lots of veterinary practices are doing some of those tests in-house, stains for crypto and so on. And if there is dying calves and we're not 100% sure of a confirmation of diagnosis, I would be encouraging people to send a sample for a post-mortem if possible. So confirm the diagnosis, by whatever means you can get. The rapid tests certainly have a role, but to be careful that what you see matches the results are matching what you're seeing on the farm, and that there may be a need for confirmatory testing.
Okay, very good. So Ciara, just coming back to a point that you made during your video as well then, you can't stomach tube milk to sick calf. How come? Because you're stomach tubing them with colostrum.
Yeah, so the difference there is really in around the age of the calf and the size of the rumen. So when a calf is newly born and you're stomach tubing colostrum, the rumen is very, very small, and the colostrum basically just overflows straight out of the rumen and into the true stomach where it can be digested. But every day that calf gets older, the rumen gets slightly bigger. And what happens then is that the milk sits and pools in the rumen, and it can't be digested in the rumen. So it just ferments, and in itself, it can actually make the calf quite sick. They can't digest it. It's not of any use to them, and it can actually make them feel worse. So no, we don't recommend stomach tubing milk. Stomach tubing colostrum and electrolyte solution, if the calf won't drink it, both of those are absolutely fine, but not milk.
Okay. I suppose we just to come to very briefly, because we're going to be out of time, in relation to pneumonia, because obviously Catherine would have mentioned it there in her video as well about it being one of the significant causes of death in calves. Does the IBR vaccine cover calves for pneumonia, and also should calves be being vaccinated for RSV and PI3 pneumonia? So I suppose, Michelle, I might go with you now first.
I thought it was after escaping. I guess it comes down to what you have seen in the herd or what's been diagnosed. Probably no point in, shooting into, whatever.
The dark.
The dark. Yeah. That's the word. It's late. Try and get a diagnosis. Swabs or I guess in a calf, bloods aren't much good because calf's probably too young, but nasal swabs are very beneficial. But it is very common in calves, RSV and PI3. So I would see a lot of herds vaccinating for it, yes.
And would there be kind of an issue there in terms of if the calf is getting pneumonia, are they more prone to scour? So similar to the way that if they get a scour, they're probably more prone to getting some other infectious agent. Does it work both ways?
Well, it's again, goes back to what Catherine was saying there, if there's cold, any stress on their immune system really predisposes them to another disease. So one can contribute to the other, yeah.
Okay, so very good. And then just the final question, I suppose, in relation to the pneumonia. This is a tough one now. Ciara, I'll throw this one over to you. Why do calves get pneumonia when they're out at grass? Okay,
so a lot of that can be down to parasitic pneumonia, so lungworm. So calves, when they go out to grass in their first grazing season, they have never been exposed to lungworm before. And when they ingest it and those lungworms start to multiply, they have no immunity to them, and they will shed lots of eggs and lots of larvae out onto the pasture. So there can be an aspect of parasitic pneumonia to it. The other thing to think about is that all of these viruses and things that can cause pneumonia in calves, they can still circulate in them while they're at grass. Yes, while they're housed, there may be a higher risk because they're all in much closer quarters together. But just because they're out doesn't mean that they can't suffer from viral pneumonias and things, because it can still circulate among the group.
Okay, very good. I suppose, look, we're going to have to wrap it up there. The final question, I suppose, or final point that I'll ask for you all to make is one sentence in terms of calf health for the spring of 2021. What would you recommend? And if you overlap, I don't really mind, but don't copy one another. So, Catherine, you're getting the lucky draw of going first here because you're closest to me. So, one sentence for dairy farmers and beef farmers out there to be on top of their calf health for 2021, please.
I'd say use the next few weeks to get as much preparation in as we can. A conversation with anyone who's dealing with calves, that we have a protocol and a discussed protocol around colostrum, around cleaning equipment, colostrum, and so on. I think those kind of discussions and having everyone on the same page can be really useful on farm.
That's a long sentence.
Sorry.
Michelle?
Yeah, I suppose people look for a quick fix for calf scour, and there is no one quick fix. It's multifactorial, and just to be aware of that.
Okay, very good. And Ciara, finally?
I would definitely say colostrum management. Yeah, really be on top of your colostrum management and your 1, 2, 3 of colostrum, and colostrum quality as well if necessary.
Okay, super. So thanks very much. I just have to wrap it up there because we're out of time. So I'd just like to thank my 3 speakers tonight very much for their time and their preparation for the event tonight. I'd like to thank all my Teagasc colleagues that were involved, and also the people on the AHI side of the house who have been involved in preparing for Virtual CalfCare Week. Just refer you to the videos that are already out there, and there's 2 further videos to come out tomorrow. One from Joe Patton in relation to concentrate feeding of calves, and also one from our other Teagasc colleague, Emer Kennedy, in relation to milk feeding of calves. So with that, we'll wrap it up for tonight. We wish you all the very best for this calving season of 2021. And in the current climate, wish everybody to stay safe and take care. Thank you very much for tuning in, and good night.